Hey there, Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. And again, I'm always apologize about that in my podcast, but deal with it. All right, hope you had a nice Thanksgiving. Today's the Saturday following. And if you're like most people, you may have gone out, started doing a little bit of exercise, and maybe your knee's not feeling good today. Well, let's go over the questions that I typically get, or the frequently asked questions I get on knee pain. So there's the short-term knee pain, which you're going to probably resolve with ice, rest, and Advil relief. And that's not what we're talking about. We're talking about the long-term chronic knee pain, the stuff that starts to bother you, it just won't go away. You're in your 30s, maybe your late 20s. You played some sports. Now all of a sudden, your knee's not happy. So you develop what we call chronic knee pain, and it doesn't hurt that bad. It's a little bit up and down the stairs, maybe getting in and out of the car. You can still exercise. It just doesn't feel great, but you can live with it. Or can you not? So one of the questions is, what's the most chronic cause of knee pain? I would say it's overuse and an imbalance. Okay, an imbalance can come from a long, say you roll your ankles a lot, when you're younger, or you had a bunch of sprains. Um, Suppose you had a trauma and didn't get it fully resolved. If your pelvis is out, if your knee is out, all these things create an imbalance. You got to look all, from the top down and from the down all the way up to the abdomen. So let's go to your belly button. You really got to check out how the femur head is moving. Is the pelvis balanced? Because if it's not, you're going to have some problems there, and then it puts tension on the femoral head, which is femur, and what that does is it can put direct pressure onto your knee. So what'll happen is, again, so if you just go somewhere, and so like a lot of times I think people are getting lazy, and they go, okay, let's take an MRI of the knee. Here's you got a tear, you don't have a tear, you have a little bit of swelling, you have some effusion in there, um, but they're not looking globally, because I mean, if you really did it properly, you would look so far as up. Again, you start at the abdomen, so you can look at the rectus femoris, which is the muscle. Like if you put your hand on your thigh and slide it all the way down to the top of your knee, that's the rectus femoris. Then you have the vastus medialis, which is the muscle on the inside of your leg, vastus lateralis. They have to be balanced out, otherwise it creates extra tension onto onto your onto the knee joint itself. So, most common cause of chronic knee pain, I guess, wear and tear, excessive wear and tear, and imbalance. But I really want to put the emphasis on imbalance. So, how do you stop constant knee pain? I mean, if you're exercising the knee and it still hurts, that's telling you not hitting it on the nail right on the head. There's a fantastic technique called trigenics that has opened up my eyes and has allowed me to help a lot of people with knee pain, because it reconnects tendons and muscles via the nervous system into the spinal cord to help bring about normal connection. If the nerve is not firing properly, like say the nerve in your rectus femoris, which again is that muscle that goes down the very top and front of your leg, your thigh, well, it's going to affect the way the patella tracks, because the rectus femoris inserts onto the patella itself. So these are things you can do to help you. But trigenics is fantastic. If you go to YouTube, you can look up the YouTube videos on trigenics. Very simple, easy fixes. Another thing I've started to learn is very beneficial is a thing called blood flow restriction. And blood flow restriction allows the knee, well, you put these bands around the upper part of your thigh, high up as you can go. And what it does is when you tighten it up, you're depriving the muscles of blood flow and oxygen as well. So you're creating a deficit. So when you do a couple of sets of exercise, typically you do 30 reps, 15 seconds off, 15 reps, 15 seconds off, 15, 15, 15, and 15 again. So you're not really doing a whole heck of a lot. You're doing probably about a total of 60 different exercises, which is not, again, it's not that many, but you're not doing it at a high weight, amount of weight. You're doing it more for the exercise. And when you take the bands off, the blood goes rushing in, and you're going to heal from within with blood. Cortisone is not going to heal anything. Advil's not going to heal anything. But when you get adequate blood flow to the area, that's a big, big player in why you can help chronic knee pain. We also been doing something called shockwave therapy. They're trying to get away from using the name shockwave, but it's the easiest way to describe it. It's like a pneumatic device that was originally designed to break up kidney stones. So these kidney stones, it's a pneumatic device, breaks it up. Here's the real kicker. They're now using shockwave therapy for men for erectile dysfunction. We don't do erectile dysfunction here because that's not a chiropractic treatment. But shockwave is a really good way to work around it. So I would say trigenics, shockwave. We also use infrared light therapy to vasodilate or laser. And that laser the dilation is huge because you increase the blood flow to the area naturally by stimulating production of nitric oxide. And nitric oxide is a vasodilator, and so is shockwave. Shockwave allows the angiogenesis, which is the increased production of blood vessels. So those are real way to really work in knees to get the right therapist. I mean, you could do basic. Listen, of course, you have to do some exercise as well: abduction, adduction, leg flexion, leg extension, hamstring stretches. There's a lot of basic physical therapy, but I think if you hit it earlier with trigenics, shockwave, blood flow restriction, you're going to have a much better shot at really nailing this and get back on and not have a knee pain. Because the longer you wait, the worse the knee's going to get. And the easiest thing for the orthopedic to do is say, hey, take an X-ray. Here's a tear. Let's go in and operate. And so if you want to avoid surgery, what I'm outlining is really a great way. So let's get back to some of the questions. How do you live with chronic knee pain? Well, it's up to you. I mean, it's not going to get any better on its own. I can promise you that. And if you're like a lot of people, there's guys in their late 50s and even early 50s and going for knee replacements now. Those things are only good for 20 years. So it's like one of those, you want to put it off as long as possible. Here's another one. When should you not ignore knee pain? Well, you should never ignore pain. But hopefully that's a very simple answer. Never ignore pain. And here's a good one. Can knee pain be cured permanently? I believe so. And it kind of depends on what your MRI really says. I mean, if you got anterior cruciate, medial collateral, anterior or lateral collateral ligaments, not working properly, you may need surgery. That's where an MRI is handy. Listen, things torn, anterior cruciate, posterior cruciate. So those are the type of things, they can't be cured without surgery. And surgery can cure some of these things permanently. The difference is when you get a therapist who knows the difference between what you can help and what you can't help. That's always a good limiting factor, but it's there's things I know I can't fix, refer them out. So what are the red flags for knee pain? Doesn't go away, interferes with your life, and actually your sleep is not going to be as good because when you turn at night, unless you sleep in one position the whole night, you're going to aggravate the knee, and it can probably wake you up. So that's actually one of the better questions we got here today. How long is too long for knee pain? Depends on your tolerance for pain, and what you're willing to do about it. I mean, first of all, if you're not exercising, start exercising. But it really comes to your tolerance. I mean, initially, if it responds to Advil and Aleve, well, have at it, put the ice on it, and you're okay. But when it starts to we're talking about chronic knee pain here, so typically it's going to come back. So just count on that, knowing you probably should do something, or you could just wait a few years and get your knee replaced. Kind of a very simple decision there. Here's the next question. How do I stop unbearable knee pain? Well, you come see me. I know that's a very self-serving question, but I think the thing is if unbearable knee pain, get an MRI. I mean, I really do think the MRI, you can see some stuff on X-ray, but the MRI is really more definitive. And then you have the radiologist really giving you the lowdown on what's going on because that's what their job is to do that. All right, what does arthritis in the knee feel like? Arthritis in the knee feels like not good. I mean, imagine you're sitting in a comfortable chair and you get this, you go to stand up and it's like the old, oh, you feel that ache or pain, or you get out of the car and you feel that ache or pain. Um, you get done playing basketball with your kids and you feel that pain. So arthritis just doesn't feel good. It's kind of arthritis is a type of pain, and pain is pain. It doesn't feel good. So, what does it feel like? I think you should tell me that one. Next question: what is the reason of knee pain without injury? Oh, that's an easy one. Balance in the pelvis, the knee, or the ankle, or the foot. So foot, ankle, knee, pelvis. That could be a really big question as to what's the reason for knee pain without injury. Again, it seems like a question. Okay, what happens if knee pain is left untreated? It's going to get worse. Very simple. You got a hole, you got a leak in your roof, and you don't take care of it, it's going to get worse. So that's what's going to happen if you don't treat a knee. How do I fix constant knee pain? Well, that comes off another question. Is it normal to have knee pain for months? Normal, no, pain is not normal. Pain is your body's way of saying something's wrong. So how do you fix constant knee pain? I think the way I would fix it, this is going to use the Trigenics, blood flow restriction, infrared therapy, shockwave therapy, and the Hockermed, which I'm not going to go into here today. It's a medical device out of Germany that we use to stimulate nerves. So coming off, the question here is, why has my knee pain not gone away? Well, a simple one is because you haven't come to see me. You come see me, I can fix your knee pain. How do you fix chronic knee pain? I guess some of these kind of duplicates. But what happens is I ask people for questions, and we get the questions and listen down and go over them. So they kind of seem similar. Excuse me, I'm just working off what I have here. Um, Chronic knee pain is going to take one, discipline. You have to exercise it, and I think you have to fix certain things first. So typically, if you just did basic physical therapy, where you're going to do exercises under the supervision of a physical therapist, and you have muscles involved like the popliteus, semitendinosus, semimembranosus, you can have some issues there. So that's how I fix knee pain is how I do it. It would require you to come in for an examination. If you have an MRI, I'd love to see it. But it's things many times aren't totally fixable. So typically we need to see an improvement within a 4 to 6 week period. And if not, then you have to go to the orthopedic and maybe you do need a surgery or something like along those lines. But it's always easy to fix it. Measure twice, cut once. You know, so before you go for surgery, you may really want to take it upon yourself to get other alternatives. And if you had to pick one that's least expensive, I would say doing leg flexion, leg extension with the blood flow restriction bands on and seeing how it feels then because you're going to drive blood. So that's actually, let's digress and say if there was one particular thing you could try on your own. Blood flow restriction bands can be bought on the internet. They're like they have a strap where you really want to tighten it hard. It's kind of like when you get blood drawn and they put a band around around your elbow to tighten up and see the veins. Well, it does serve a very good purpose, and you might see more results that way. You don't want to leave it on. You don't want to go. You're not going to do exercise with it on, other than your flexion, your extension, maybe your hip abduction, hip adduction exercises with it on, loosen it up in between. But that's something you might want to do. If you look at blood flow restriction, you have ones that go from $25 to $400. My take is the more fancy it is, the more chance you can have something go wrong. So I would stay away from that. But maybe you got extra money you want to spend. All right, I'm Dr. Brian McKay. I'm a chiropractor in Darien, Connecticut. I do see a lot of knees. I have a lot of fun treating knees because it's a great program we have here. But that's me speaking. And I do have to say that a lot of times I do want people to go out to physical therapy after we complete the program but it depends on how serious and what the person can afford. I can't be spending your money for you, but there are a lot of great programs out there that would really, are expensive. And my care is not inexpensive either. So I guess that's a caveat there. But if you have questions on these, well, sure, we're going to be revisiting this again not too long a time. Give us a call, 203-656-3636. 203-656-3636. Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Again, 203-656-3636. Have a great weekend. I plan on going to get myself to the gym, go for a nice swim, and I'll talk to you soon. Thanks for listening. I appreciate it.